welcome everybody to our second Client Connect Zoom meeting. And just for anybody who did not attend last week, Danielle and me, we were thinking about a Client Connect throughout that whole situation we are all in. The whole industry is literally on a standstill. And our idea was just staying connected with everybody who knows us, with everybody who wants to know what we are doing. We would like to know what you're doing. And I think we all are in this together, and we all will get out of this together. So last week we were talking about smile design. We were talking about the facial analysis and so on this week. And then we asked the attendees last week, please let us know what would you like to talk about the next time or the next few meetings. And we got kind of a few people come feedback basically with a little wish list. And so the first one I picked out of this wish list was material updates. And because in our industry right now, it is just totally crazy. We're getting materials almost every week or every month at least, new materials, improvements of materials we're already working with. So I think everybody has to go through some kind of education in terms of what's going on right now. What do we need to really know about new materials? What do we want to know new materials, basically? So quick house rules. Please try to stay muted throughout the meeting. That's so we can have a very smooth flow here. And then you can also chat on the right side. There's a little a little mouse click to click for a chat. So if you have any questions, please just chat the question, write your question in there. Danielle is the host of the meeting, so she will take care for you on this end. And when we are done with the meeting, I'm happy to answer some questions, and we'll get back to that basically. So now let's just start, right? Let's just dive into our world of materials. I have to say I was concentrating in terms of the materials a lot on more towards zirconia, just because zirconia over the last 6 to 8 months got a lot of new stuff. So, and zirconia is one of the most trickiest materials in restoration, in restorative materials we work with. So I definitely was looking out for that a lot today. I will talk a little bit about lithium silicate, and polymers and temporary materials as well. Also there's some news basically, but zirconia definitely got some interesting stuff. So let's just dive in. And the materials in our digital dentistry world. That's something very kind of global. To look into very global is materials in our digital dentistry world are just almost the same as we utilized it before already. We were used to work with metal, with glass ceramics, lithium silicates, et cetera, but there are some new materials like nano hybrid ceramics. We're not going too deep into that. They're not as critical in our industry right now. They will come more and more. They were here already. They're kind of got lost a little bit, but they will definitely come back with our more conservative dentistry, and especially with polymers in combination. We'll maybe talk about this in the future more and more. Then zirconia, of course, that's a hot topic. And in the zirconia, especially the cubical zirconia, is a very, very important material, what I definitely want to talk about today, because there's a lot of confusion out there. So let's just dive into a little bit. Just in general, who knows Zahntechnique knows we're trying to give every restoration the human touch. That's kind of my credo, my philosophy. What means if I look into full counter restoration out of zirconia, I still try to make them as natural as possible. And that's possible with our new materials, with new zirconia. I mean, I look into a full counter crown, it doesn't have to look like a full counter crown. It can look like actually a tooth. And that's kind of, I think, where we all want to be, at least in my world. I try to basically work with materials that they look as natural as possible and really blending into the surrounding dentition, basically what we see here. As you hear, that's actually the crown in the back here, so it matches nicely in. So, but of course, we also want to talk about big cases today, about full mouth or full arch reconstructions in a little bit later. So if you look into a case like this, so that is the case, we'll just can say, well, it's just a regular 3-unit anterior bridge. What's the big deal? Well, the big deal is when I see the photo, I'm getting a lot of red flags. Some of you maybe as well, some of you maybe not. So let's look at this together. I see 2 prep teeth, and it's number 9 and number 7. But the problem is both prep teeth are totally different in color. Number 7, even, you can see the tip a little bit, the incisal tip. It's a post, basically. It's a root canal tooth. So that tooth will be totally inconsistent in the future in color, because we will maybe realize the color will change in that tooth. It will be maybe good brown or dark gray, even black. I will show you a case in a little bit where something like this happened. So here we're a little bit limited in terms of materials what we can use. So if we try to use something more in a higher translucency, we'll definitely have no control over color here, because color will change over the future. In the future, when that prep number 7 will change, and that can reflect on the pontic, and it can reflect on number 9, basically, just because you have a disbalance in color. So this restoration we're going to plan here has to be something more opaque with a higher opacity. So that means higher opacity, we also can or should utilize most likely porcelain to still get something nice, something aesthetic on top. So we want to layer something to keep the anterior aesthetic, because if you look at the neighboring dentition, they have pretty translucent teeth. Number 10, I mean, just looking at the distal line angle, it's almost gray translucent. So I have to have something more aesthetic here, or more translucent here, to actually be able to make this blending in. So I decided here for a PSE. So we made a very reduced or facially reduced framework and then layered porcelain. And now just because also 300 bridge, it's nothing special, but now when you see how it actually blends into the mouth, it definitely blends in very nice. So that's kind of what we would like to see, that we actually see something blending to the neighboring dentition, and it's not just basically sticking out like a restoration. And that patient was very happy. So that's kind of where material choice is very, very important, and that's what we want to explain today. Same case here, we're restoring these 2 premolars here, and you can tell it's a very, very colorful situation. So we have not the lightest colors, it's more like an A4. Here it's basically 5M2, 5M3 even. And but here it's different. So here we don't have root canal teeth, we have vital preps. So it means there is no risk for changing. So we actually can go with a full contour or full anatomic restoration in a very high translucent material. So I used here actually a super high translucent zirconia and just stain and glazed. So now if you compare these 2 premolars here with that molar crown in the back, which is also a full contour zirconia crown, I mean, this is like night and day, both zirconia. That tells me zirconia is not equal zirconia. So there is definitely a difference in materials, and nowadays even more important than ever before, because we have so many different zirconia, we have so many different manufacturers of zirconia. So it's really crucial to look out to where do I get the crowns done, and what kind of material is that laboratory utilizing. That's crucial to make a decision. What kind of material are you going to use for that patient? If you see the 2 premolars, I mean, they're blending definitely nice with that canine here. There's really for a full contour, there is no porcelain utilized in this case. So now, if we look very, very quickly, I think you most likely all notice nowadays about the wear factor. Zirconia does not really wear natural dentition, opposing dentition. That's just a little statistic here, going from cobalt chromalloy down to manual polished zirconia. And you see here the wear, it's just a very little wear here in compared to a huge wear facade. Veneering porcelain, also huge wear facade. Why is that? Just because veneering porcelain or alloy is more porous than a manually polished zirconia. Zirconia is the material with the highest density, what we are actually having available right now in our industry. So that means the surface of that zirconia is so smooth, it doesn't wear opposing dentition. Because strength doesn't mean it wears. It's the roughness, the porosity, basically, the surface texture that wears. Therefore, it is very important when you see the comparison here, unpolished zirconia or polished zirconia, there's a difference. So if you're seating a zirconia crown and you have to adjust, you have to really, really polish it very well with I always recommend the white universal polishers, basically, and then a diamond polishing paste for a nice shine. And then there is no risk for any wear on the opposing dentition. So now looking into these different zirconia types, we have that generation 1 zirconia with 1500 megapascal, roughly plus minus strength. High translucent zirconia is around 1200 megapascal, which is still good for full arch reconstructions. And then we have the super high translucent zirconia, what I just showed on the 2 premolars, which is just about 650 megapascal. If we compare that material with lithium disilicate, which is roughly 450 to maybe 500 maximum megapascal strength, it's going to be very close to that, but still stronger. The advantage on that super high translucent zirconia is I definitely have a smoother surface. Okay, so that kind of makes it maybe easy to choose what material you would like to choose. I'm fine with even doing little 300 bridges with that material. I personally would not do lithium disilicate bridges. It doesn't make sense. The material is not built for or not made for bridges. I have to make connectors. They're so big, it doesn't make aesthetically and functionally not any sense. Now, if I take out these two more kind of progressive zirconia and these 1200, 650 megapascal, I now have, since a little bit, also the they're available in pre-shaded and multi-layered. And that's kind of where I want to talk a little bit more about today, because here in Zahntechnique, what I'm utilizing barely any white zirconia would have to color, because I'm losing consistency in my coloring. So I'm actually utilizing purely pre-shaded or multi-layered. The multi-layered is definitely absolutely kicker, because it is just very, very aesthetic, and I can definitely fabricate really aesthetic restorations in full contour with that. And I will show this in a second. So here now, the first generation zirconia, very opaque. I utilize this usually for hybrid abutments or telescopic crowns, maximum strength for good support, and the white color is just opaque. It blocks everything underneath. If I now look into the high translucent zirconia, I can utilize for full arch bridges. And in the anterior area, I prefer to layer, at least micro layer, certain areas for more translucency, for more aesthetic. In the posterior area, I definitely can utilize that material in full anatomic. Now, since February, we have a brand new material on the market with that specific zirconia, which is in that strength also a multi-layered gradient. And that definitely is good, especially for these big hybrid cases, to use totally monolithic. I still have to layer the pink. The pink in zirconia is just very hard to really get perfectly done. So you still have to utilize some pink porcelain there. But we can fabricate highly aesthetic full contour crowns like we see here. That is that material. We call it Generation X zirconia. So it's basically multi-layered, super high strength, and we're getting that result. Or here, utilized in full contour. So now if we go a tick higher aesthetic in the super high translucent for individual crowns, the pictures are a little bit, leaning a little bit away. These are 6 individual crowns. I put them together for a photo, basically, but I can utilize that material for really nice aesthetic cases, basically to match even neighboring teeth, or just to achieve a balanced aesthetic and balanced translucency. If I have 4 or 6 or 8 crowns next to each other, it's perfect, that material. Be careful with this material in terms of discolored stumps or metal posts or metal abutments, root canal teeth. Same like lithium disilicate, it will be too translucent. So I cannot utilize that material for the fact we have maybe a root canal or an implant or a metal post. I definitely have to have something more opaque, what I showed before, to kind of cover that, to mask the underneath color. Yeah, same here. This is a full contour crown, by the way. Yeah, I just layered that little edge here, the little incisal edge. I layered with some clear, very low fusing porcelain, just to get some kind of color play in that. So now that is my test. And I did one of these crowns is full contour, the other crown is layered. You barely can see a difference. I see it because first of all, I know it what I did there. Second of all, I see it on the surface. So I'm not going to ask now in a webinar, hey, arms up, who thinks which one is which. So I'll just go through and explain it very quick. So I basically was in a course. I layered one crown, we put them on a model, and then I just started glazing it and tried to match both as good as possible together. And when you look at the different angles on the case, you literally cannot see which one is layered and which one is full contour. So now I will lift the secret here. Number 8 is monolithic. Number 9 is cutback. For me, I see it because number 8 has more shine to it. That's kind of the very typical surface of a full contour zirconia. Number 9 is basically more kind of an orange peel effect. That's more like a layered crown, basically. And here the little schematic, what I utilized on colors and stain and glaze that you see. It looks very complicated. It's not. There a lot of repetitions in there, but that's basically how it is. So now let's dive into a case into one of my most difficult cases, most likely over the last months. That's Milo, and Milo is 9 years old, and he literally broke his number 8 doing sport in school. Sport accident, broke number 8 on marginal level, on gingiva level, basically. So now what to do in a case like this? So the doctor here decided to make a root canal, take the nerve out, and he made a little build-up, and they basically decided then to actually extrude that tooth with an orthodontic treatment to get some more retentive surface to actually do a crown. And so unfortunately, or obviously, it's a root canal tooth. That preparation is very, very dark. So that's the one portion what was very difficult for us then later on to treat. The other problem was because it's actually most of the portion of that preparation is root, so you don't really have an emergence profile. So it gets thinner and thinner and thinner. So we had a hard time to actually getting the crown matched to number 9 for the emergence and still having a hygienic and good tissue support around that crown. So that was a little bit tricky. The biggest problem at the beginning was finding the right material to cover that root, and the doctor and patient and mom of the patient did not want to use any metal. So what I did basically is I tried different copings in different zirconia. I tried different zirconia. Oh, by the way, why not Emax? First of all, there's no enamel, so I can't really bond to it on enamel. I have to bond to dentin, basically. Second of all, the root is so black, so dark, that any lithium silicate would show what's underneath. And there is a very opaque lithium silicate. In my mind, I have a hard time getting that to an aesthetic point just because of light breaking and light reflection. So I rather work here with zirconia. So here now, I made some copings in different translucencies, basically. So the first one is like a super high translucent. The second one you see here is more the high translucent. And I made a third one, which is the very, very opaque generation 1 zirconia. And that's what we use, because as you see, from left to right, we have a very gray looking coping. In the middle, we have kind of whitish, grayish translucent. You see the core still through. And on the right side, you definitely see that it's just masking everything underneath. And then, of course, I tried different internal stain techniques and layering techniques. We did some try-ins with Milo, and that was already very, very close now. But here you see also the challenge, what we had here basically around the cervical area. The emergence was just very hard to get. That was not the main problem. The main problem for Milo and his mom was the color, basically. And then finally, we were able to actually match it. And that was the day before the Christmas holiday. So he was very happy. I still have his thank you note here. So thank you for letting me smile on Christmas. So that was very, very nice of him. And the only problem is I know that he will be back very soon because he's growing. He's 9 years old. So, and that crown will not grow with him. Yeah? So we will see him most likely very soon for a new crown. And that will most likely go with him and with us for the next year. So we have to treat him. Yeah, but he's such a cool kid. So it was fun. It was definitely fun to work with him and with his family and with his doctor. It was fantastic. So these are kind of the tricky things, yeah, where you really have to look into material and trust basically your ceramist or your technician in terms of what kind of material is the best for a specific case. So when I like to see what we see here now, just a photo, I like an impression, and then I like to basically discuss, hey, what would be the best material to choose for that patient, for that case. Here, the same thing, that was a case I did with Dr. Lopez. 8 and 9 has to be treated. And you see there are just multiple different colors in that mouth. And we have to start now for treatment. And then so a good color communication from her side. Yeah, so it's great photography to give us a good idea, give me a good idea about the colors. Very, very important. What you see on the photo is here on the big photo. I see the preparations. That is extremely important nowadays to make a material decision. I have to see the preparation. It can be just an iPhone photo, I don't care, but I have to see if it's more yellowish, more grayish, more whitish, or even discolored. I have to see that. Yeah, so it's very, very important. Never forget about communicating the stump shade. That is important, not just when we do lithium with silicate, just in period in general. Here she even takes a nice shade guide to that stump just to give me an idea in what range are we moving around. Yeah, and that basically, let's go back very quick, that dark stump. And then when we look at number 10, that's kind of whitish look a little bit, already tells me we cannot do a super high translucent zirconia. I'm much more comfortable with a high translucent zirconia to mask a little bit underneath and then be able to microlayer the facial aspect of these two teeth, of these two centrals, and be able to make a beautiful finish and having really the crowns beautiful blending into that array of different colors in that mouth. Yeah. By the way, you know that most likely a patient, or we all have 24, 30, 28, 32 teeth. We have 30 different colors in our mouth. Yeah. So not one tooth is exact the same color as the other tooth. I think that's very important. We talked about this last week with facial analysis. It's very, very important to be realistic also with patients and remind them that nobody's symmetric and we don't have all the same colors in our teeth. It's natural. So now let's dive deeper into kind of problem solving and go a little bit away from zirconia, and we can go deeper into maybe a different situation, especially in implants. On this case, that I got that case a while ago, and with the question, well, what should we do here? Yeah, so first assessment of the case was, well, we have two very narrow implants, two Straumann narrow crossfit. We have a lot of recession here, a lot of bone resorption, and on top of this, we have an aesthetically driven patient. So all things there sometimes don't really play very well together. Yeah, so now we have to make a decision how to execute that case. So first of all, in this case, we decide to make an intraoral scan. So we decide, okay, we want to treat that case digitally. It's just a decision between the dentist and me. He asked me, can we do that? I said, yes, no problem. We definitely can manage that case fully digital. So now, then of course, digital design, digital fabricated, finished with the human touch, as mentioned earlier already. So what does it mean, digital design, digital fabricated? Well, it means we have to utilize a material I can utilize digitally. Yeah? So I'm not going to do a casting, because casting would be not digital and I have to make different verifications to it, and so, et cetera, et cetera. So I would like to utilize basically a material I can use really digital, so I can design, I can print and mill the case. So let's look into this. That's my intraoral scan. And from there, I started designing the case. On this case, also back to assessment, we decided to utilize a high performance polymer as a bridge, as a frame with individual preparations. And why did we do that? First of all, if I go back, let me go back very quick here. If you see that big resorption of bone and gingiva recession, I assume we will have most likely more changing gingiva over time. That means I have to be prepared to maybe change that bridge over time, but not losing the bridge. So I want to be able to actually add pink to the bridge over time without having the case maybe sent back and forth within the laboratory and the practice. So the doctor here, he's in Dallas. He's a prosthodontist in Dallas, Dr. Fuqua. And we're here, so he works with us in these cases. So he's able now, with a high-performance polymer framework, adding on composite chair side, if there is a little reline necessary. Yeah. Then on top of this, we would like to have maximum aesthetic with the teeth. So here, also we want to have teeth or crowns that really bond very well to the polymer. So I utilized lithium disilicate in this case, because lithium disilicate can better bond to a structure than zirconia. So here now, on top of this, I can etch lithium disilicate. So I really have a very good surface to bond something to it, because also I want to bond the pink composite for the gingiva replacement to that. So we'll see that in a second. So here's my bridge. I mill the bridge. I also design the crowns in one shot to the bridge. I mill everything, print the model, and I can finish the bridge. So we see here now that high performance polymer framework on 2 vario bases from Straumann. I then can see here my waxed crowns. So I milled basically the crowns in wax to be able to press them in lithium disilicate. Here now I do the porcelain work, either layer or just staining glaze. In this case, we actually decided for staining glazing, just micro-layering, maybe some tips here and there. And I can then bond the crowns to the framework. And you see here in the fourth picture, starting the layering of my pink composite. And that's the final case seated. So you see here, ideally, it's very hygienic. There's no flange or ridge lap. The patient can go underneath. Also, you see here, the entire surface is still a polymer. It's highly polished polymer, what the patient really can clean very easily because nothing sticks to it. There's no plaque adhesion. There's no bacteria setting in there. So you usually try to have that contact with the tissue in the polymer material. On top of this, if we have to, we could theoretically layer underneath to that entire surface very easy, more composite, just for relining in case the patient would have more recession on the tissue. So that's a case which can grow with the patient over the years, and we don't have to redo anything in the near future. So that's kind of a very safe solution to actually have something like this executed. That's the reason why I chose here. My material decision was here polymers with lithium silicate and composite. So now a question always comes up, well, what happens with the transition between the ceramic crowns or porcelain crowns to the composite? We're getting that transition line and we maybe get discolorations. Yes and no. Actually, no, because if we treat that in our fabrication process the right way, and I have a protocol for that, and I go really strict by protocol, that composite is literally bonding to my ceramic. There is no discoloration at all. The only thing what I have typical on composite, it will get dull a little bit over time, and that just can be refreshed either with reglazing the composite or just repolishing it every 2 years or every year, once in a while when the patient comes for a hygiene appointment, for example. Yeah, it's very easy to actually treat that case in the future. So let's see. There were some questions. I'm not done yet. I just want to make sure we're not missing anything. Okay, I see. We will go over this in a little bit if that is okay with you guys. Then we can just move along. So full arch rehabilitations. Same thing. Material decisions are just very, very important for any kind of full arch. Here, I utilized a a high performance polymer bar instead of a metal bar, just for aesthetics and for weight. It's extremely light. I can make individual crowns on top, and I can finish it up without having any metal opaque or any grayness of metal. I have a very natural looking final restoration. That's what I'm looking for. Yeah, so that's extremely important for full arch case to make the right material decision, especially for cantilevers or for long spans between implants. And that's kind of, you have to definitely talk to your laboratory to get the right consulting. Like in this case here, we did also a high performance polymer framework with individual crowns and composite. You can tell that that's one of my favorites to do that nowadays. Why? Because if I treat that case like a very typical hybrid denture with a titanium bar and acrylic and denture teeth, I have a lot of wear on these cases, and I have a lot of fracture and chipping and so on. On a case like this, it's not, because I have porcelain crowns, ceramic crowns. These are in wax now. They're getting pressed in lithium disilicate. And before I press them, by the way, usually we go to trying, because it's easier for you to adjust wax than ceramic, to do all the adjustments in the mouth and then press them in ceramic and finish the case. That means occlusal adjustments are to a minimum when the case gets seated. But back to the material decision is there is no wear in this case. That case will not wear like a acrylic case, which actually extends the lifespan of that case tremendously. Yeah, so here now the finished crowns. Now they're getting back on the framework. By the way, you will see here the crowns are very long. That length here, that neck, is later on all in composite. I need that for retentive surface. I like to make them as long as possible, because that gives me a nice area to etch and to actually apply the composite to it. And then you see again the entire surface is in high performance polymer, just for hygiene purpose, that the patient really can clean it very nicely. Nothing sticks underneath the restoration. Here's the final reconstruction, and then seated in the mouth. And it's a very lifelike restoration. They're very natural, and there's a very vitality to this restoration because of these porcelain crowns, of these ceramic crowns. And now she's actually considering doing the lower as well. So now, how can we keep control over these full arch of these big constructions, or even just an aesthetic reconstruction, aesthetic restoration? Is prototyping, right? Prototypes are nothing new in other industries, relatively new for a lot of dental professionals. Now, sometimes we just jump into that black hole that I showed last week, and we're just putting some teeth in, and the patients are not happy, and we struggle in getting the aesthetic the patient is looking for, or the function actually that we're all looking for. So I always recommend, let's do a prototype first before we jump into the final, and make sure we are on the right track. And like I say, building houses or new cars, new developments on the road, and in general, prototypes are nothing new. Everybody does it in other industries to be able to be very efficient with the final reconstructions later on. So we see here now, I utilize a very new temporary material, for example, which is called the A-temp. It's just a new not a polymer, a new PMMA, which is very fine, but also it's extremely color stable. And the advantage is I'm utilizing the temp and the zirconia from the same manufacturer, so I actually have the same color. So if I'm going with an A2 and a temp and go with an A2 and a zirconia, they're almost matching perfectly. So that's kind of what I like to do. In this case, we did a little prototype before implants were placed to see we made a little bit rich augmentation here, and then for future implants. So that went in. So now we're waiting for the implants to heal to do the final, but the patient already knows that's actually the final color. So now we can talk. The patient will tell us, well, hey, Alex, this is too yellow. I like this more white because I live in Boca and I want a Boca white. Now, it's just kind of, it gives us already a good idea about the final aesthetic look. And that's very, very important for many people, or for all of us actually. So here in this case, I showed that case last week. I'll go quickly through that case. I'm not showing all the slides, but that is a very typical case for a prototype, where a prototype is necessary, absolute, because of the collapsed bite, and aesthetic as well. It's a full mouth rehabilitation. So we're not jumping just in and starting with some crowns and a bisbake. No, I would like to do first a temporary to know if that is the patient, what the patient really likes. We have in the upper and the maxilla 200-300 bridges, and the anterior will be 6 crowns, and the whole lower will be all crowns and veneers with some crown lengthening cervically, and we open the bite between 5 and 6 millimeter. So here we made the design, what discussed last week, and we fabricated these prototypes. So we fabricated shells and 2 implant bridges in a PMMA, in that high aesthetic PMMA. And be able now to see that in a patient's mouth to get an idea where we are. An idea, okay, is that really what we're looking for? That was digital designed, or does the patient maybe would like to have something different, smaller teeth, larger teeth, longer, shorter? So now we can actually really work on the aesthetic with that case. That's very important. A case like this, same thing we did here. We took over a case with composite veneers, and the patient wasn't happy. Now also the patient would like to have all the lower arch done with veneers and crowns. So we did a prototype first, we see the right side to see if that's what the patient wanted. The patient wants to white, just really white. That's what we did. And then we finished it up with here we did a little trying first and to tweak something here and there, and have a nice final result with a nice anterior aesthetic. That's possible if we really follow the prototype protocol and be able to keep a very good consistency about tryings and photography. Next case here, we did lower crowns in the mandible, on the right side of the mandible. On this side, you see this is a bridge, temporary bridge with the material matching to the color, very, very close. All the upper crowns are all temporaries. Matching very, very close to the lower because it's the same color. So that's kind of, we really have to, or be able to keep track over aesthetic in combination with different materials. Same thing here, implant dentistry, immediate place temporaries for immediatization of implants, of course, guided surgery, but then also utilizing materials. They're just very natural, multi-layered PMMAs or polymers, and then they will match already the future restorative material very, very close. And then we're able to actually follow our guidance with the prototyping to a final here, in this case, a final Zirconia hybrid, just with micro layering. Same thing here on the full arch case, we utilized a old or a current hybrid, and the patient starts breaking teeth and chipping teeth over time. So the doctor here would like to have a Zirconia hybrid. The problem was here a little bit cantilever problem, so the cantilever was relatively long. In my mind, a Zirconia cantilever should not be longer than 1 premolar size, also in hybrids. Doesn't matter about the AP spread. If the AP spread allows and we have to get longer cantilevers, I like to utilize a titanium bar structure underneath the Zirconia. Just for more strength and for more support, I have no breakage on anything as long as it's good supported with the titanium bar and this one. Same thing, we're creating a prototype in PMMA, sending it out for a try-in so the doctor can adjust the occlusion, can do all aesthetic adjustments, what's necessary, can even send the patient home for 1 or 2 days and see if the patient likes it or if the patient would like to have some changes and comes back to the laboratory. We can rescan that and can then basically mill it in Zirconia here. You see the area where the titanium bar fits in. And we then can finish it and make it ready for seeding into the patient's mouth. The very, very successful restorations without any trouble. Now, no trouble is the best trouble. And same thing here. In this case, we decided to do a lower mandibulary hybrid with a titanium bar and acrylic, very traditional. And on the upper, it will be a Zirconia. Why did we do that combination? Because Zirconia against Zirconia is just very, very loud. So the patients, they clock together when they eat, when they talk, You can hear it. It's just really loud and very hard. So I always recommend utilizing, if you want to do one arch zirconia, on the other arch, either the upper or the lower, in a different material, like either a traditional acrylic hybrid with titanium bar, or even a polymer, what you saw before with individual crowns, because the polymer is able to really damp down that noise a lot. So that's kind of my recommendation. In this case, of course, the acrylic will wear very fast against that zirconia, or actually will most likely also get fractured very quickly. So at some point, we have to most likely do something else in the lower. Sometimes these decisions are economic decisions, because that's just a less expensive restoration, for example, an acrylic. It's just, of course, that's the kind of the entry level, and then we can build it up to different, more expensive materials, also more labor-intense workflows. But same thing here, we did a prototype, and you can tell it doesn't really go with the patient's face. On the upper right, it's a little bit crooked. God thanks, we did the prototype. It looks good here, but also then the midline, you see it, the slide can't basically. So that's the communication. We have to know in the laboratory, if you do photos, always do full face photos as well. These are very, very important for us to see. I want to see the eyes, the nose, the ears. I want to see how that restoration fills the face, that we can make a decision what can be changed, or what we want to change, or what can we even change. And then the final zirconia construction, and really comes out very nice, and he was very happy. Gets back to the lab, the prototype gets back to the lab. That's just a picture of a sent-back prototype, kind of sprayed to rescan to be able now to change it. And then we have kind of, this is a different case on the left side. It's not the same case. Just try-in face. It's just a quick printed try-in, then a prototype face, and we have the final face of zirconia. And we see here the final reconstruction in zirconia, just micro-layered. So that was basically, that was it. Before I say thank you, and before I go into the questions, I have two things I definitely would like to communicate with you. One thing is Danielle, she did a social media movement just recently. I want to show you this. Please watch very quick and listen.
My name is Danielle Wünsche, and I'm a small business owner. I'm co-owner of Zahntechnique Dental Laboratory in Miami, Florida, where we're passionate about partnering with dentists to create smiles. When the economy restarts, I kindly ask for you to support your local dental practice who sends work to a business like mine. There are more than 30 million small businesses in the United States. Please keep small businesses in mind when you regain financial stability and begin to purchase products and services. I'm going to tag several small business owners. If you're tagged, please introduce yourself and your business to America and tag 3 more small business owners. If you're watching this video, please share it to support Small Business America. We can come together by supporting each other when the nation's economy restarts. Small biz strong.
So that's kind of a message, since we are in the same boat all together here. It's not really dental related. We basically would like to support our small businesses. You are small businesses, we are a small business. And I think in the future, we have to be more sensitive in general about small businesses, that we support them, that we go with them, and buying from small businesses, they buy from us, and so on. So it's kind of a movement where we have to support. Just look into our Facebook, social media, or Instagram. You will see that post. Share it, comment to it, just play with it. It's gonna be a good thing. I also want to say, I will start with the questions in 1 second. I would like to make you aware of our YouTube page we started. There are already some really, really nice videos on there. We're also working on right now on the zirconia video. You will see some repetitions of that lecture, but you will see more in-depth information about new zirconia on the market, and definitely good tips how to utilize that. Subscribe to our channel, please. It helps us, it helps you, and you also will be informed every week, every second week, basically about new videos coming up. We try to have that very, very active and interactive. So I would love to see you as our new subscribers on our YouTube channel. It would be fantastic to see you there. And then Danielle, you want to go through the questions? I'm open the chat here, and I see you guys are very active. That is great. That's fantastic. So let's see.
Great. So I know there was some discussion when you were going over the case with Milo. There was, I think, discussion. Dr. Ginsburg was just talking about the core and the darkness of the core.
Yes.
I didn't see a question there, but just a comment. Dr. Miller did ask if I think Dr. Lopez used polar eyes for color matching. So we can definitely have some discussion here. That question, I think, was to Dr. Maribel. I'm going to also unmute you, Dr. Lopez. And Dr. Lopez?
Yes, I'm here.
Okay, great.
Hey, Dr. Lopez.
The question was
Hey.
the use of polar eyes for the shade taking. Can you talk about
I'm not using polarized at all. I learned a lot about photography from Alex at a course that I took with him. And Alex, remind me the name of the doctor that came for the
Miles.
Miles.
Yes.
It was fantastic. And you guys talked a lot about the polarized. I just never got to use it. I'm using a twin light attached to the lens of the camera. I was using at that point, and those pictures that you saw there were taken with that twin light attached to the lens. Now, something that I discussed with Alex was also stationary flashlights not attached to the lens. And that I bought 2 cheap tripods from Amazon, and I got the lights. Alex helped me with ordering them. And it has made a great difference because when you move the camera, the light doesn't move with it. So I'm using that now more than the light attached to the lens. Now, when those pictures that Alex very kindly, thank you for showing my patience.
You're welcome.
Show there, those were taken chairside. Those were not taken in the studio. The last ones were for the hybrid case, but not for the 2 centrals. So those were taken chairside, and of course it's easier to take the pictures chairside with the regular twin. Exactly, those are like quick pictures, like right off shade pictures. I do take with the twin flashlight attached to the lens. So
so for shade communication, I can add a little bit to that, because that's a very, very important point before we even go into materials. Twin flashes are crucial for any anterior shots. Same thing if you use a ring flash, for example. Ring flashes are great for posterior shots because it will light up the whole mouth. But usually with the ring flash, what happens, we're getting overexposed pictures. So I personally don't really like them for shade communication. We don't really have to also communicate a very picky shade on a number 1 or 2, right? So that's kind of important. So I like the twin flash. The Canon has a great twin flash. There are multiple others out there. What Dr. Lopez is doing, I love the setup. What she has is 2 tripods with stationary flashes basically, and that allows her really to get a phenomenal consistency on her photos. So you can really put everything on nicely. You have the patient sitting on a chair, and you can just move the patient around, and you have your flight, you move the camera around, and everything is really consistent in lighting. That's kind of what I love on her setup. For shade communication, again, twin flash is really absolute what I would call for any kind of communication. Not really diffusers on there because they can actually alter the color a little bit. So I like to use it just plain. And for the beauty shots, yes, there we can use diffusers and boxes and soft boxes, whatever, but not for just clinical shade communication. I would not use any soft boxes. So I would just use the plain light and move the flashes to the right position. exactly. I see another question was here. What model camera do you recommend for this kind of photography? Camera-wise, your camera is secondary, just period. I use a Canon 70D, EOS 70D. It's actually already an old camera. The camera is secondary. Important is your lens. Important is the light. So these two things have to play together. The camera, the body is just taking everything in what's coming in through the lens with the light. So if you have an older DSLR camera and you have great lenses for, or you have already lenses for, you want to now stock up more lenses for that dental photography, keep the body and just purchase very good lenses. I recommend for shots like this, for these more kind of beauty shots, when we set something like this here, I recommend having a roughly 100 millimeter macro lens, call it telescopic macro lens, basically 100 millimeter. The range is between 85 and 150 and 120 millimeters. My personal one is a 100 millimeter macro lens that gives you the right, or the perfect depth of field for these kind of photos. And I have that red stripe lens from Canon. That's a professional photo lens, but you don't really have to use the professional lens. A regular 100 millimeter macro does a very, very, very good job. I hope I answered the question with that. By the way, you also can now use, instead of DSLR cameras, the mirrorless cameras. They're getting better and better. Canon and Sony is definitely phenomenal up for there. And Canon has some really, really nice bodies now. I mean, they're getting really good. The advantage, what I would always go with Canon, is because I already have the good lenses for Canon, so I would just stay with that. Always the question, Nikon or Canon? That's kind of always the little battle. It's like Android or Mac. Both are great. I personally love the Canon glasses, the Canon lenses so much that I go with Canon. Other people like the Nikon body more, so that's kind of, it's a matter of taste, basically. What's the next question? Let's go through this a little bit here.
There's a question.
That's a great question. What I read here, the acrylic is, if the acrylic is in contact with tissue, it's an irritant because of porosity. Yes, and every acrylic. So the question, it's actually a statement. What's here? So if the acrylic is in contact with soft tissue, with gingiva, and the gingiva will be maybe irritated, is because of the porosity of the acrylic. That's true. And the fact is, every acrylic is porous. We can heat cure acrylic. We can cold cure acrylic. It doesn't matter. We can polish or polish acrylic. It will always be porous. There's no way to get acrylic to the same density or surface sealant as zirconia. It's just physically not possible. It looks nice, but as soon as it goes in the microscope, we see all the porosity. That's just nature of the beast. I have a question here. What is the advantage over monolithic zirconia in regards to repair? Is that the right answer? The advantage over monolithic zirconia, well, advantage of monolithic zirconia is definitely economics. It is usually less labor intense to fabricate something. Second of all, monolithic zirconia, we don't have that fracture or chipping risk. On the other end, I'm now kind of going on both sides. If the framework of the underneath structure, let's say zirconia or metal, is properly designed, the risk of chipping is minimal. Yeah, so it comes down to, most of the time, the advantages of any monolithic restoration is economics. Also, the monolithic advantage is I can follow a digital workflow. So I can design a smile. I can send it virtually to the dental office or to the patient. They say, that's it. I want exactly that result. And I can fabricate something like this finished. As soon as I have to put my hands on, I'm most likely not 100% in the same way I just designed, just because it's handmade. So I cannot follow 100% the same texture line, the same line angles with my hands. I can get close to it, maybe to 95% or 90%, but not to 100%. That's the advantage of the monolithic. The disadvantage, it will never look as lifelike as a layered restoration. I can layer so much nicer than I can do anything monolithic, even with the super high translucent multi-layered materials we have available now. Let's see. Okay, I think we are almost through. See here on the dark, some cases you never use an opaque because framework design. I know will is more important. That's true. That's true. Dr. Miller, Nikon, yes, I use Canon. I think we are almost through here. Dr. Gerkes, on the dark stem cases, do you ever use an opaque telescope crown to eliminate the value issue and then a Emax over crown? Absolute phenomenal question. I can hear here's a prosthodontist. Yes, we absolutely use sometimes these double crowns. I would not say telescope because telescope in my mind is something different. Usually telescope cases are removable. So these double crowns basically where we utilize a crown to mask the underneath color and then do a beautiful work on top as a crown. Yes, that can be done. The advantage is I have full control over color. The disadvantage is if it's in the anterior area, the doctor has to prep relatively deep to hide the transition between both crowns. So, and also you most likely have to over prep slightly to be able to have both layers on top of each other. So keep that in mind when you plan a case like this, then it can be tricky. Yeah, so we have to definitely be careful what exactly we're doing there. But yes, I did this. I will do it in the future. It's a great solution to do cases like this. Absolutely. Any more questions? Okay, I think we are.
It's also a great time, Alex, to remind everyone what the next topic is for next week for our webinar.
Thank you. Now, see, Danielle is so important to have here as the host. Thank you, Danielle. So again, first of all, I want to say thank you to everybody to join us here. It was fantastic. I saw also we had more people than last week. That makes me even more happy. I hope we have next week even more people. It's a great time actually on a Wednesday afternoon to get together, right? Anyway, so next week we're talking about complex implant dentistry. We'll talk about alternatives on screw-retained hybrids. So we're not talking about screw-retained hybrids. I want to talk about alternatives. What means I would like to discuss basically telescopic restorations, full arch telescopic restorations, MK1 restorations, locators, attachment over bars, whatever basically is not really removable, but removable and will solve the most trickiest situations. That's kind of our topic next week. Please, if you have a case you would like to even need to maybe pre-plan a little bit for next week, let me know. Just send me photos, send me some information, call me, we can discuss it very quick, and I can even show it next week, and we actually can really, out of the bat, just talk about a case. Why not? I'm totally open to that. That will be fun, actually. Then on top of this, for the meetings after, still give me input, give me some feedback, what you would like me to discuss, what you would like me to present on, and what you would like to know, where we can, on the technical side, can help. So let us know, please, give us feedback. I love to get better, not just in dentistry, also in presenting. So also please let us know what we can do better here in these webinars. And yeah, I think we're done. We had an hour together. It was awesome, and I'm looking forward to see all of you next Wednesday. Also, if you would like to invite some other of your colleagues, please let me know. We'll send them an invite. Thank you so much. Have a great rest of your day.
Yes, thank you for joining us, everyone, and please look out in your email for the post-event survey. Give us some feedback on how we can be better, like Alex mentioned before. Thank you for joining us, and be well.
Thank you. Bye-bye.